Hello, everyone, and welcome to another episode of Healing Conversations. My name is Einav Avni. I'm an energy healer and alignment coach. And this podcast is all about energy healing. No, it's not about energy healing. It's about natural healing, healing yourself naturally from chronic pain, chronic illnesses, or unexplained medical conditions. Today, with me, I have Naida Alexander. Naida, so lovely to have you here. Welcome.
Thank you. Thank you very much, Einat. Thank you. Good morning. Good to see you. Thank you for invitation. Great to be here.
Wonderful, wonderful. So I am so excited to have you here. We're going to talk about your research and about your findings about medical miracles. Can't wait to hear more about it. So let's get started. Tell us anything about you. Where do we start?
Yeah, of course, of course. But I think before I start and before we talk about medical miracles and research and healing, I have to say to all our listeners that the same moment I've seen you on Facebook and I wrote some very short message, or it was the vice versa, I don't remember. It was the immediate friendship and understanding because we both have so much in common and the same views, the same absolutely, understanding of everything, of health, of diseases. So I'm very happy to be here today again because we talk the same language, actually.
Absolutely,
Yeah.
absolutely. I think that's exactly why I'm so excited about this conversation. Bringing you and your message to the world and being a part, being able to really speak the same language is so exciting.
Yeah, of course, and I will continue exactly from this point of language, because every day we meet people, especially in this area of healing, of medicine, and when we meet people that talk the same language, we all understand that there is a language. It's not like you are a nice person, or I met some nice say somebody. No, there is a language of healing, and it's absolutely universal, absolutely. And this will be probably my start point. I will introduce myself, of course. Okay, so hi again to everyone. My name is Dr. Naida Alexander. I'm a clinical researcher as a background. I'm a doctor of medical sciences and doctor of integrative medicine, but that's the official part. I will tell a little bit about myself. My background is in clinical research. I'm owner of international company in clinical research, which works with pharmaceutical companies and biotechs and hospitals and FDA, which means I'm absolutely coming from very, very conservative approach in medicine, not only conventional medicine, but research, it's very, very strict and we have to prove everything. We have to come with statistics and the graphs and the assumptions. So I come from very, very conventional point of view in medicine. And actually, life happens to all of us. And during this way of a very amazing career and my own company, clinical research, many years ago, I've actually met my own challenge, not of my disease, but the disease in family of my father. And today, when I make lectures and I talk to people, I understand that this was the very, very first point of my journey. But it was very, very unclear then, because what I've made, first of all, I applied to conventional medicine to look for solutions. And you spend 1 year, 2 years, 3 years, and you don't have any solution. And then again, as many of us, we look on alternative medicine, and we start to talk to people and to go to some visits and read papers and books, and that's actually what I've started to do again from no choice point, just to check, not from my knowledge or nothing. And then I spent a few more years. I'm telling you, it doesn't matter the exact amount of years, but it was very, very long journey as well in alternative medicine. So from one side, I was trying to find a solution, but from other side, as a researcher, as a scientist, I was learning and asking many questions about almost every field in alternative medicine, if it was energy or flower medicine or you name it. I mean, almost every field I was very curious about, and actually I spent few more years in this direction. And then slowly, I understand one point, that first of all, I did not have a solution. I did not find any solution from one side. From another side, I understand even bigger problems, that I came to point of myself, which is absolutely confused. I felt a huge distance between conventional medicine, which is my background, and alternative medicine, which is very nice and helpful and interesting, and it is like no endless you can try and learn your whole life. But actually I came to like a T junction in my life, professional, personal, from all aspects. And I asked myself the question, how we are going to heal? Because all of us, because you look on statistics, you look on graphs, you look on all this, what's going around in hospitals, and you understand that not we are all, but most of the people today are healed. And I have even some numbers, according to one of the publication in Lancet, what is Lancet, one of the leading medical journals, they say that about 95% of people in the world are ill, or was ill in the past, or ill now, which is absolutely unacceptable number, I think, absolutely unacceptable. And then I asked myself very, very, direct question, how we are going to heal with this medicine, with that medicine, with all these methods, and with all this confusion around. And then actually I thought about people that are healed every day, not only healed from diabetes or headaches, like for example, but they are healed every day from stage 1 cancer, from what is called very, very difficult diseases. And then I said, okay, let's do the following. I will put all my knowledge and all my experience and all my assumptions aside, and I'm going to raise my own research, official research, because I'm a scientist, it's a whole background. I'm going to raise my own research totally dedicated to the phenomenon of medical miracles, or, in medical language, we call it the radical remission. Radical remission or spontaneous remission, that's another interpretation. But actually it means that no one from conventional medicine expects you to be healed, or even, even in alternative medicine, sometimes people don't expect miracles. But we have so many people, and you know it very well, so many people who are healed, and the self-healing, it's not about self or not self-healing, it's about healing from very, very severe diseases. And then actually I've spent few more years, I was talking about years and years and years, and then I've spent few more years for raising this, I've called it revolutionary research, because it describes about 100 people, when each and every one of them is medical miracle by himself or by herself. We have I can give you just an example. It's not only stage 4 cancer, it's not only pancreatic cancer, for example, it's multi-organ failures and chronic diseases after 20 or 30 years of suffering, and etc., etc. And
I just want to pause for a second, because it's so, I definitely want to hear all about this research and everything that you found. I just wanted to just make a point that how fascinating it is that you come from that medical background, and for you to recognize that maybe you don't have all the answers, and to say, let me go and have an open mind and see what else I can find it feels like so much more than maybe, the average person that is suffering from chronic pain or illness, because they have to decide that actually maybe they don't no longer, maybe that there's another idea other than the medical doctors. But for them, it's a question of trust, right? What do I, what can I trust? What can I do? But for you, it was also a question of your whole life trajectory, your whole belief, your whole everything that you knew until that moment was actually, now we have to take it apart. And I'm not
Yes.
saying you stop believing in science and the Western medicine and all of that, but actually I just want to appreciate that your journey into coming into alternative medicine was so much more, well,
Challenging, very challenging. And I can assure you that I'm outsider still. Even we have, not only me, but again, we have enough doctors and scientists, and from coming from conventional medicine and coming from science, who are looking for answers and are ready for integrative medicine. We will talk now a little bit about integrative medicine, which is actually a combination, but combination not only 1+1, conventional plus alternative, but with the taking into account the whole background and understanding and consciousness and the reasons behind the diseases. It's not like take from one method from alternative medicine and some pills and combine them together. We all do that without understanding. And actually, integrative medicine, which is for me is the future of our medicine all around, is a conscious combination and, of course, personal combination of the applicable methods, from both worlds of medicine. Yeah.
So where do we start? Are we talking first about what is integrative, the integrative methods, or are we going to talk about the research? I am excited to hear about both.
Let's talk about the research, because actually integrative medicine is the whole name of this research and of another research. And when I will explain you now the approach, you personally know, but I will open it now to our guests and friends. But when we understand my research, 4 aspects of my findings, then we understand actually that this is integrative medicine. So I will go back to research, okay? And I will go back again. I will just ask you and all our friends to imagine this frustration, absolute frustration, professional, personal, that you don't have any understanding anymore what you are going to do, how you are going to help your loved ones, your parents, your children, your friends. And then I come to these people, absolutely amazing. They are absolutely healthy, and I say to them, hello, I'm a doctor, and I would like to ask you only one question. What did you do? Actually, of course, it's a whole research behind with the questions and graph and numbers, but it doesn't matter. The main question was, look, I need you. I am a doctor and I'm a scientist, but leave it. I need you to tell me how did you do it. And then I came with a long list of methods from alternative, conventional, whatever medicine, and they actually answered what method and what approach they have done for healing, and what is the contribution of this or another method. And the most amazing point in my research was that after 3 or 4 or 5 patients, I'm telling you the truth, maximum 5 patients, I understood everything. And it was like, wow, I'm telling you, it was unbelievable. When I told you before about years and years and years of science and research and the learning, and which is all okay, but no answers, basically. Then after few patients, when they shared with me their stories, I said, wow, this is a solution. This is a way. When we started our conversation and we said we both talk the same language, and we just, we feel it. But when I learned it from the patients, when I learned the way how they did it, after 5 patients, I could close my research because it was so straightforward and so convincing. And then actually I continue from these 5 to 100 patients, okay? But the way, the roadmap of healing from severe diseases was absolutely the same, absolutely the same. It was like copy-paste, all these, the answers, all their actions and thoughts and beliefs and the, emotions were absolutely the same. And then I said, wow, this is the way. This is the way. And
so let's just sharpen this point. So we're saying that you had a research, you took 100 people that miraculously healed themselves, and now you're sharing what is the insights that you found. What is this copy paste answers that you came up with?
Yes, it's actually a formula, not it's a very big word, a formula, but this is a way, this is a roadmap, this is a solution. And actually I will tell now that this roadmap actually is divided into 4 principles or 4 components. Of course, when I had all these research findings, I combined them with all my knowledge and experience from all worlds, and then actually I present this approach. So let's talk about 4 principles of the medical miracle or radical remission. The 4 principles actually are the same basic 4 principles that every area in our life is based on. It's like our career and our health and our relationships and our dreams and everything. So let's start from the first one and not keep people waiting. So the first one is all about our mind. And I understand that people are bored more or less, from mindfulness and mind, and everything is your mind, but what to do? The true is the true. And let's talk about medical miracles again. What is a mind in radical remission? Mind is actually the very, very first step in my journey to heal. And what does it mean? It means that all these people, all these amazing people, all of them, all 100 people, had the one time point in their healing journey when they actually had a decision. When they got a decision, a straightforward decision, not like I'm not sure, maybe tomorrow, maybe in a week. It was a straightforward decision that I'm going to heal. That's it. No matter what my doctor said, what my family, no matter if the conventional medicine or alternative medicine has a solution or not, I'm going to heal. And actually, I want to emphasize one more point. It's not about beliefs, because we will come to beliefs in now, but when we talk about mind and getting a decision, it's a very simple. It's like my self-confidence. It's my responsibility. We talk a lot about responsibility in healing, and of course you talk about responsibility as well, because that's right. But this is the first point, to get a decision. I'm going to heal, which means a lot, which means that I have to do something with my decision. It's not like I'm getting a decision and let's wait what happened. It's about responsibility as well. But except of responsibility, there is one more point. When we are able or not able to get a decision to be healed, we have something another very strong behind it. We all have to have a reason, a reason, like for example, the reason can be very simple. That's enough. That's enough. It's a very deep reason. If you suffer from chronic pain 20 years, 20 years, and actually you suffer from very miserable life, which is full of pain and pills, and you are dependable on your family members, etc., etc., etc. So the reason can be in this aspect, that's enough. I'm going to heal. I think you do agree and understand totally this point, okay? So
Really, it's really. I love that this is one of the points that you found, because so many times people they say I want to heal, but it's not I am going to do this, and so there is that gap of what can come in between, and I see it with so many people, the ones that believe that they really, you said no belief, but okay, you said decision, but the ones that says, right, there is no plan B, this is how it's going to go, they are the ones that they have so much more energy behind that really, there's a massive force behind that. Yeah,
exactly.
and you mentioned the reason, right? And I know you spoke before about wanting to go dancing with your grandkids on your,
Yeah, and why we tell again about mind and about the power of thoughts, because like you said, and like me said, first of all, you have to have a reason, because if you don't have a reason, you probably will not get any decision not to change your career or, move to another house or whatever. I have to have a reason. And then I get a decision. And then from tomorrow morning, I have to build a plan. Okay, so it's not like just sitting and make a decision. It's a very strong reason why I am going to heal. I'm going to heal, and then I'm going to build a plan. I'm going to find the people who are healed from my disease. I'm going to pay, to pay costs, to do physical activity, to change my diet, etc., to change my mind, to change my soul. And there are so long very, very long journey. So this is actually the first aspect of mind and making a decision. The second one, and I think everyone who is listening now, and of course you, the same approach is our emotions. Is our emotions, and actually understanding the emotional source of our diseases. We all talk about, body, soul, and the mind and spirit, and I don't like this because it's very cliche, but when we go deep and deep and deep, and we look on our own life and our own diseases, and I have enough experience already with the working with people, believe me, when you ask a person in a very quiet conversation, and a very open conversation, tell me, why do you think you are ill? Why do you think you have this cancer? Why do you think you have this 20 years chronic back pain? And you know what? If the conversation is really open and really, reliable, you rely on your friend, on your therapist, almost everyone knows exactly these emotional or inner reasons of of conflicts, of underlying reasons, of source, whatever we will call it. But people know. That's amazing. People know. We don't want to deal with it. We don't want, to think that this is a very, very deep reason for my disease. But we know because we suffer from my country or my government or my husband or, my whatever. We all have this understanding. And actually, the research findings that the radical remission or medical miracles will never be possible without understanding of this very, very deep emotional root of the disease.
Mm-hmm.
Now, do you hear me? I think the screen is frozen.
All right. Yes, I can hear you. Sorry, I do know that why the internet is not so strong today. I can definitely hear you.
Okay. Okay. No.
I just want to take a moment and again, this point about emotions is so amazing, and I do believe that, you know, in your findings, because it's only when the people understand that there is an emotional root cause to their conditions that this, you know, that they can allow themselves to start healing. Because if they really believe that their body, you know, whatever they're going through is structural and they need surgeries, they will never get there. So this is so, you know, so connected. There's no separate point of, you know, I believe I can heal and then not acknowledge the emotional root cause. And it's so important. I mean, I constantly talk about emotions, but I understand now that another word that maybe is more palatable, I guess, for people is to understand stress, because stress and emotions are really going hand in hand, and it's really understanding that there is a time, you know, that we really can't take it anymore, and if we don't release the emotion, if we don't release the stress, if we don't know how to deal with it, then it's the body is going to say, right, you know, enough, I can't, and hence what it is that you're going through.
Absolutely.
I just had to say that, but I am going to please let you continue with the
No, I'm happy because I know this is your very deep interest of all this emotional healing and understanding and the traumas. But it is. I think we are not revealing now nothing revolutionary or new or extraordinary to understand. Like I said before, we all know that we have conflicts, we have suffering on such or another level, which is okay because we are humans. It's not like blaming yourself or myself for my disease. This is a very huge mistake that people sometimes say don't want to touch. You know, I know that I have a emotional conflict, and when I come to my therapist or my doctor or whatever, and he will say me, okay, look, you have this conflict, now you have a cancer. This is a huge mistake, and I have to talk about it a few words. This is a huge mistake because it's nothing about blaming. It's absolutely the contrary approach, because only when I understand, when I'm ready to go deep to myself, not in order to answer you or my doctor, to answer myself, and only when I'm ready, when I have this, you know, courage to go deep and look on this conflict, then I have all the tools and all the knowledge to resolve it, and to resolve actually my physical disease. And this is very important. Of course, we can talk about soul and emotion conflicts now for hours, but let's continue to the next principle. So we talked about thoughts, we talked about emotions, and the third one actually is our actions, okay? Because let's say we got a decision, we had a reason to heal, we are ready to build a plan, and we did this amazing emotional journey with the psychotherapists and my therapists, and I understood my inner conflict. Okay, now I have to act, right? I have to do with this something, okay? And now comes actually even deeper the integrative medicine definition, because like we said before, what is integrative medicine? It's a combination, but it's not a simple combination. It's a very conscious and deep understanding combination of conventional medicine, of alternative medicine, of self-healing. It's not only going from one therapist to another and make a list of treatments. No, sometimes you have to sit at your home and and continue your journey with yourself. That's it. And it's also integrative medicine. But the main, focus is that I have to be aware what I'm going to treat and how I'm going to treat. Because if I, for example, understood my emotional conflict, okay, now I know exactly what I have to do, what I have to resolve, okay, and then I will go probably to therapist that is familiar with this kind of treatment or whatever.
Yeah.
And and actually, when I work with people and we ask these questions, and I do a lot of workshops and sessions, how we actually behave. We behave like a random, absolutely random manner of treatment treating ourselves. First, we go to hospital, to medical center. Okay, we got some pills. Okay, it work. It doesn't work. Okay, then doctor said, okay, it didn't work. You have to go surgery. Okay, it's more afraid, more deep, and then it did not help. So we try. We try something new. When you read in Facebook and you talk to people, this is the classic journey. The pills did not help me. Okay, I will try alternative medicine. But let's ask ourselves, what is alternative medicine? It's endless world of 1 million methods and 1 million therapists and 1 million approaches. What is alternative medicine? How you are going to choose a method or therapist? And only when we are connected to ourselves, and we are honest to ourselves, and we are ready to ask ourselves, what do I think will be the best approach? If it's a touch therapy, if it's a meditation, if it's a music therapy because I'm a music person, maybe it's animal therapy because I love dogs, and it's not like it is therapy. And then again, we come to self-connection. We have to take responsibility and to ask ourselves so many questions. What I think will do the best approach for me. Okay, and this is one point. The second point is never give up, because again, as I've learned from these amazing people, no one from them gave up. At any point of the healing journey, it can take 1 year, it can take 10 years, but you are not going to give up. And I think you will agree also with this point.
Absolutely. Absolutely. I know on the other hand how confusing it can be to say, people that come to that action and they say, okay, what can I find? What are the alternative modalities? What can I do for me? And people start that research, and very quickly they don't know, right? There's so many, and I think people come to me and they say, oh, I've tried so many things, and by the time they come to me, they really doubt anything, and that's kind of that's an interesting thing, right? Because if we go back to this knowing the decision to heal, now they might find themselves in a very shakeable situations where they say, well, I really tried so many things and nothing worked. And of course, in my personal conversations with people, I can tell them that what we really want to do is to get into the thick of it. We really want to understand what is going on. What are the reasons why nothing worked so far? What is it? Some of the questions that you already raised, right? What is the reasons? What are the reasons that you want to heal? But also, what are the issues that brought this on? What are the emotional causes? So I want to open up this conversation to say, hey, it's not just, it's not one path. It is maybe one path, but it's not a straight, from A to B. It's a journey, and when you accept that it's a journey, we can get to where you need to get to. And when you are on a journey, it's not just the end result, right? It's also about everything that you're learning in between. So
absolutely. And I would like to mention even a additional point in what you have saying, which is absolutely right. Sometimes people are so crazy in this journey, for example, or in alternative medicine, and they're trying, the green juices and meditation and the healers, and they go here and they also go there for retreats, and nothing helps. And then when I see these people, we all feel them. It's not like it's not funny at all, but sometimes you see this person and you have to tell him, just stop. Don't do anything. Just breathe. breathe, go home and enjoy your each and every second. Because you have to understand, like you said, it's a journey, but journey does not mean that you have to do everything 1 million treatments and then you are crazy. You're crazy. It's nothing about methods. It's about your understanding that sometimes you have to keep quiet. To keep quiet. That's it. And So this is actually this integrative medicine and the conscious approach to how actually I treat myself. I don't give up, but I choose the methods very consciously. I feel that from time to time I have to stop. I have to calculate my road, from again and continue because I'm not going to give up. That's it.
Exactly. That's the fire from step one.
Yes, absolutely. And what is interesting, which is very interesting and very encouraging in my research, when I mentioned 100 people, it's related to this point, 100 people healed from incurable diseases. Let's ask you, because you don't know, but I will try. What do you think the time period they were healed from incurable diseases on average? Because of course I said it's a research, so I have numbers and averages for everything, and I have a number of healing time, average healing time. What do you think is the number? I will try to ask you.
Okay. Let me just ask myself. I think
Because you have this experience as well, but let's reveal it also to our
I think
friends.
it's less than a year. I think it's less than a year. I'm going to go for around 6 months.
Wow, I can't believe you enough. And we did not talk about this, absolutely not now and not at our first conversation. Average is between 6 months to 1 year. Can you believe it? I can send you a graph and the statistical numbers.
Amazing.
That's amazing. This is a language. Do you understand now? You understand, of course, but we talk about, the whole approach. This is a language. You did not know it.
No.
You don't have a research. You do have a research. You all have research and proofs, but you know this number from your clients, from your understanding and experience. Between 6 months and 1 year, this is a journey of healing, physical healing. But what is important is that the journey is endless.
This is important. I said before because a lot of the time when people come to me for discovery sessions, it's a lot of the time they bring this question of time and they say, basically they have no patience. They say, I've been suffering from this thing for such a long time. I need to know that I'm going to heal. I need to know. And for me, this need to know is actually a big part of why this is not going away. You're kind of putting, sticks in your wheels. You're not helping yourself. I really do believe in what you said before. Just take pause and just breathe and let go of all of this need, because need not going to get you where you need to be. You want to be language. It's not going to get you the results that you're after because there's too much pressure. So you're no longer in flow. You're really in hardship. So I do want to say to people, yes, it is a journey, and we're going to do everything that we can, but we have to take it as it comes. We can't force it, because when you force it, you're changing the trajectory.
Yeah, you are so right. You are so right, because this is the only way. From one side, you are not giving up. You are trying, and you paying costs every day, and you like changing again all these actions that we do. But from the other side, at the same level, we have to not to give up, but just to let it happen without any sticks, as you said in calendar. And then probably it is the right time to come to the last and the fourth principle, which is all about beliefs. And okay, it is a little bit connected to decision, but it's a different word, because again, all these people who are healed from by miracle ways. All of them did believe without no matter what that I will be healed. I choose in life and not in death. That's it. And why it is different, I will explain in one sentence why it is different from making a decision and the reason to be healed. Because when we talked about decision, we were looking for a reason to be healed, which is absolutely okay and very deep and very important. But when we talk about beliefs, like I choose life, I'm going to live, I'm going to stay here, that's it, no matter what, then we have to ask ourselves, what is my reason to live? What is the reason for me to live? To wake up every morning. And this is nothing about my physical disease. This is nothing about my chronic pain or my cancer or my Crohn's disease or whatever. What is the reason that I live here? And if I don't have this reason, or I'm not asking myself, or I did not ask myself for the last 40 years why I'm here, probably this is the time to ask yourself. And this is your challenge. Like, okay, let's now to see my life as a whole and see what is my reason to live. And this is actually very, very deep, spiritual, belief-related approach. And yes, actually, what you said before, when we keep on in two hands, like, for example, different approaches or opposite. From one hand, I have to struggle, I have to be healed. From other side, I'm free. I'm here, I have a reason to live. And this is, I've seen so many miracle stories when people were still physically ill, or, for example, they have any physical disability, like no hand or no leg, whatever. You cannot heal, you cannot grow a new leg. But they were so strong in their decision to live, and they had a very deep, reason to live, or, whatever. So they just don't pay any attention that they are physically, restricted or whatever. This is very, very deep understanding of the whole journey, like of course, and agree.
I completely agree. It's that focus. It's that focus that it's so interesting, because so often I see people that they're not ready. They're not ready, and they're still in that story of, this has happened to me, and now I have no chance and no choice, and I have to go through this, but I'm very resentful, and I'm very angry, and I'm very frustrated. But they don't have the tools or the insight to say, actually, there is a bigger picture here. There is something beyond this. This is not a life sentence. This is just a pause for me to reset and to really find my actual trajectory that I came here to be. But until they find that there is something bigger than that, then they're very much in the story, and they're very much in victimhood. These people, I say, when you're ready, come and let's have a conversation. But anyone else, when they do understand that there is connection to their emotions, and there's a bigger reason for this, and this is happening for them, not to them, then the conversations are so much more profound and interesting and life-changing, because all they really do then is they know that anything can uplift them, anything can get them the next nugget that will move them to the next level. But when people have a focus, when they have exactly what you say, this reason to live, it becomes, because a lot of the time people say, afterwards, that they're so grateful for this illness or disease or condition or whatever, because it woke them up. It brought them to a place that they could never get before or without this happening. So
absolutely. And sometimes, like you said, people are changing, and they undergo very, very deep transformation finally in this healing journey. And the people sometimes, as you said, think, okay, the disease was my gift. But I don't like this statement, because there is even deeper statement, okay? That disease is like a package of your gift. It's not a gift. Disease is not a gift. Come on. We all agree. Disease is not a gift by itself. By disease is a package of my gift, and only when I am able to completely heal, okay, not like to maintain my blood pressure with 100 pills. That's not called to be healed. That's not called, if you go from surgery to surgery, from chemo to chemo, it's not like I'm healed. No, when we talk about radical healing, medical miracles, I understand that the disease was actually a package, packing of my real gift. And what is the gift? Is myself. I finally understand who I am and what is my life purpose, and what I do every day. And think this is the highest gift, in whole universe. And
yeah, absolutely. So I guess, you can look at the illness maybe not as the gift, but the key, or the gate, something that brought you to
it's a
journey.
gate. Yeah.
Naida, we only have a few more minutes before we have to finish the conversation, but I definitely feel that we have to speak more, because what you have and your knowledge and the research and the conversations that you're having, they're so important to anyone that is going through chronic conditions. And let's agree to come back to reunite together, to have another conversation in the not too far away future, so that we can build on that, because I really do believe that this is the message. Only in these kind of conversations we can bring this message to anyone that needs to hear it.
Absolutely. And let's say just finish with only one statement, that miracles happen every day, including medical miracles every day. And there is a very, very straightforward roadmap, and that's it. We touched only, in brief all this roadmap, but it happens. Medical miracles happens every day.
This research that you've done, is amazing. It's amazing that you took 100 people and so quickly you found that they have a common, responses. And like you say, it's a copy paste that every person that healed.
It's a copy paste. Absolutely. Yeah.
Exactly. And so really, this, if people were thinking, hey, conventional medicine is science, and so I need to believe that. Here is another thing that you can absolutely believe, because yes, it takes more work. It's not a magic pill. It's not a magic wand. You have to do the work yourself. But actually, there's some things here, the 4 pillars or 4 principles, that if you're able to bring yourself to follow them, then this is your science. This is your proof. This is, how do you say, the roadmap.
Yeah,
so
absolutely.
I'm very excited about that. And I'm going to, of course, leave all of your details with the chat, so wherever people watching or listening, they can get in touch, they can find out more. And for anyone listening, watching, I really do encourage you, first of all, to get in touch with Naida if this is right for you, but also just let this conversation and information and message to come through, because you can heal yourself naturally. You can have a miracle, a medicine miracle, my language now. But just, you have to start somewhere. Start by recognizing that maybe where you are now is not where you're meant to be, and there is a way forward. Maybe that is a message. Naida, thank you so much for being here with me today. Thank you.
Absolutely. Thank you enough, and have a nice day. Thank you to all our friends, and we'll be in touch, of course.
Of course.
Thank you.
Thank you.
Bye.